Thank you. Good evening, Your Worship and members of Council. A very snowy good evening. My name is Barbara Love, and I am a very proud and enthusiastic member of the Royal Victoria Regional Health Centre Board of Directors. This evening, I'm joined by Janice Scott, the RVH President and CEO, and we're pleased to have the opportunity to come before you again to provide another update to our long-range expansion plan. Many of you know, as a longtime Innisfil resident, I've been a strong advocate for bringing healthcare closer to home for Innisfil residents. Most recently, I was thrilled to take on the role of the honorary fundraising chair of the Rizzardo Health and Wellness Centre. We know that the town's health report, which was prepared by York University and Georgian College several years ago, reported that access to health care is a top concern for residents of Innisfil. And that's why RVH has engaged in a 2-year long-range planning exercise that's been very comprehensive and very thorough. The town of Innisfil has been very involved in our planning since the beginning through Mayor Dolan and CAO Jason Rayner, who sits on the Capital Planning Committee. We're very appreciative of their insight and their perspective. Since we last spoke with Council and also with Innisfil's Community Health Committee and Sandy Cove Acres residents, RVH's vision has continued to evolve. RVH's plan will ensure residents receive the health care they need and deserve as South Simcoe County continues to grow. We're very excited about this ambitious plan, and we know that you will be too. The first step in our graduated plan has already started. In December, as you know, RVH opened a variety of outpatient clinics at the Rizzardo Health and Wellness Centre. You'll see several of us up on the picture. RVH leases 5,000 square feet of space in the center where we offer a variety of clinics for children and adults, including preschool speech-language pathology, preschool occupational therapy, preschool autism diagnostic clinics, infant hearing screening, pediatric asthma clinics, low-risk stroke clinics, internal medicine clinics, COPD clinics. And we continue to expand the clinics in the coming months, including an urgent geriatric care clinic and an adult asthma clinic. RVH's clinics also provide some cardiac diagnostics such as echocardiogram, electrocardiogram, and Holter monitoring. We also offer cardiac rehab at the YMCA right next door. A wide range of RVH clinical staff work out of the RVH Health and Wellness Clinic, including doctors, nurses, nurse practitioners, cardiac diagnostic techs, respiratory therapists, speech-language pathologists, and occupational therapists. Although the individual clinic schedules vary, RVH space is opened weekdays 8 till 4. Since we opened, the RVH clinics have logged over 600 patient visits. Innisfil patients and their families are so appreciative of having care closer to home. Like little Tiago Rodriguez, who's in the picture, that you can see, along with the RVH pediatric staff. We heard from one Innisfil mother who used to spend 2 hours getting to and then another 2 back from Innisfil, getting to RVH, and she is very relieved to have the clinic open. Our patients are almost as enthusiastic as Mayor Dolan. Thanks also to councillors who joined us for our opening last month, including Bill Van Berkel, Donna Orsatti, and Kenneth Fowler. I'd like to now pass the podium over to Janice Scott, RVH President and CEO.
Thanks very much, Barbara, and good evening, Mayor Dolan, members of council. Thanks for having us back again this year. And we're really excited to present an update on our planning documents. When I look at this first slide, I think really, and look at council, I'm preaching to the converted, because you, better than many of us, know about the population explosion that's going to be coming our way in both in terms of further north into Springwater, Barrie Annex lands, Alcona, and of course areas south of that. So we know that Simcoe story is a story of growth, it's of progress, and it's of innovation. So over 74,000 more people will be in Innisfil alone, and that doesn't even include Friday Harbor. So the total population of the area coming to us over the next 2 decades is 173,000 people. It's a bit like taking Oshawa and moving it all into our community all at one time. But the total population, which is actually 370,000 people, would be closer to London, Ontario. And if you're familiar with London, you know that there are 2 major health organizations, the London Health Science Centre and St. Joe's, but they have multiple sites. So the point really being that the single site up at RVH North Campus will certainly not suffice for what we know is coming in terms of population growth. But it's not just about growth, it's also about aging, and we have an aging population. The growth rate is faster than the provincial average, and in 25 years, Simcoe County will have over 107,000 seniors, representing more than 30% of the population. And why is that significant for hospitals? It's significant because, on average, seniors use 4 times the amount of hospital resources as the rest of the population. In addition to that, of course, about half of the provincial health budget is dedicated to seniors. So when we think about growth plus an aging population, we know we have some tremendous challenges ahead of us. So we've talked about growth of population, aging of population, but as well, there are also a number of health risk factors that unfortunately we also have to identify because they have a huge impact on the use of hospital resources. So habits such as smoking and drinking, not exercising, not eating a proper diet, all mean that our fellow residents throughout Simcoe County are not as healthy as our provincial counterparts. In fact, 45% of our residents today have a chronic condition, and 1 in 5 of those residents have multiple chronic conditions. And we do know that chronic conditions lead to more hospitalizations at an earlier age, but also for a longer period of time. So it's incumbent upon all of us to really focus on prevention and wellness and ensure that maybe the health problems that we foresee will become the problems of the past, and that hopefully people will be living longer, but also not in need of a hospital as often. We also know the hospital of the future will be greatly impacted by the excitement and the growth of technology. It'll play a key role in RVH's hospital of the future. It could be artificial intelligence or 3D printing. Technology is going to transform how healthcare is delivered, and certainly the RVH of the future will not be the RVH of today. We know that more care will be provided on an outpatient basis. Really, there are also advances in virtual healthcare, meaning that consultation and follow-up can be done outside of the hospital. RVH's South Campus will focus on outpatient care in the first decade. But neither technology nor prevention efforts will alleviate the need for beds. Population growth combined with our aging population means the demand for beds will continue. Because the reality is, today at RVH, we're bursting at the seams. Every day we're full. The occupancy rate is between 115 to 135% some days. And when the beds are full, it creates a gridlock throughout the hospital. Patients end up waiting for beds in the emergency department, and wait times grow. Last year, that meant over 3,000 patients were cared for in hallways, quiet rooms, temporary surge beds, makeshift care spaces with no windows and no private washrooms. And this is not the care that RVH wants to provide for anyone, and it's certainly not the kind of care we want to provide for any of our loved ones. So now imagine that with the dire situation we'd have if we put on top of that 173,000 more people. That's why we need to have an expansion plan now. And we've designed a graduated model that will allow us to bring care closer to home as soon as possible. We also wanted to highlight for you some of the wait times that we're currently facing, because we know that this really has an impact on all of our residents in South Simcoe as well as Barrie. For example, at RVH, a hip replacement is almost a year wait time, whereas the target is 182 days. Knee replacement, 2/3, 3/4 of a year. Cataracts as well. The only area with next to sort of the provincial targets that we are keeping pace with would be our cancer surgery wait times. And if you're waiting for an MRI that's booked, you can wait 120 days, and CT 53 days. This is because the population growth and the demand with the aging population and less than healthy habits means that the demand for these services is much greater in Barrie and South Simcoe. Even in our ED department, a patient will wait almost 5 hours to be seen, and I probably have stories here in other places where they waited longer, but those are our statistics. And what we're trying to achieve is about 1.7 hours. So it's not the care that we want to provide, and we know that we need to expand immediately. In order to ensure that our processes were well followed at RVH, we always have a strong governance structure. As Barbara mentioned, she's a member of the board of directors and representing Charlotte Wallace tonight. Thank you, Barbara. And the board developed a capital planning committee. It's chaired by our second vice chair, Doug Frost. In addition to the board members, of course, on the capital planning committee, we've also included municipal representation from County of Simcoe, City of Barrie, Town of Innisfil, and the Town of Bradford, West Gwillimbury, as well as a member of our LIN, our Local Health Integration Network. Doug Frost, who is the chair, we anticipate having Doug around for another 7 years. Maybe he hasn't read his fine print yet as a volunteer board member. But our hope is that not only will he continue on our board, continue chairing this committee, but see the projects, many of them, to fruition. After that, there's a Capital Planning Advisory Committee, and this is the committee that I have the privilege of chairing. We advise the Capital Planning Committee. Not only do we have our senior leadership team on this committee, but as well our volunteers, staff, physicians from our hospital, physicians from the community, and a patient advisor as well. And I really want to take an opportunity to recognize Ben Peterson, our Executive VP, who's been leading the entire capital projects. Thanks, Ben. To the right of that, you can see the South Campus Site Selection Committee. Of course, this one would be of great interest to the council here this evening. And not only do we have members of our board again on the South Campus Site Selection Committee, but we've also added 2 members from our community. One from Innisfil, Chris Garraby, who was a past chair of our board and past chair of the Capital Redevelopment Steering Committee, and Dan McLean, who lives in Springwater, was also a past member of Simcoe County. So this group, and then that little orange square at the bottom really represents hundreds and hundreds of people who have given their time and effort, physicians, staff, nurses, and volunteers, to working groups to make sure that the plan was in fact effective and very, very detailed. So in order to move forward, we have in fact a 2-campus integrated model that has been developed. As Barbara mentioned, the first step was our graduated model in December when we opened clinics in the Rizzardo Health and Wellness Center. Over the next 10 years, RVH will invest more than $14 million into this health and wellness center. It clearly not only allows people to stay off the highway and receive outpatient care, adult and pediatric, closer to home, but it also does really ensure that RVH's South Campus is secure in this area, as we are your go-to hospital. Next, we'll begin to renovate and redevelop spaces within the current facility, including emptied shell units that were built as part of the 2012 expansion. This is known as the pre-tower phase of our project. With this phase alone, which we'd like to complete within 6 years, we'll be able to add 91 new beds, and therefore we will once again assist with government with ending hallway medicine by adding more beds to our North Campus. This is within current spaces that are already there, shelled in and ready to proceed. Within 10 years, we will complete the South Campus Health Hub, and this is a structure I'll talk a little bit more about. At the same time, we're going to develop the North Campus Tower. All of this with an eye to, beyond the 10-year period, the South Campus having post-acute care beds. These are beds such as rehabilitation beds, complex beds that will allow us to have patients on this site, but they won't be dependent upon the type of beds you would have with a 24/7 emergency department, which would have an intensive care unit and a number of other auxiliary services to support it. That's the last step, which is really the 20+, where the South Campus Hospital will be a 24/7, 365 hospital of the future, where all of the services that would be provided through that, having that H on the side of the building, and people from the far and wide, including the 400 and Yonge Street and beyond, will be able to come here for a full-service hospital. So with this approach, we believe that we'll be able to secure approvals in a reasonable time frame, we'll begin providing services as quickly as possible, and will increase the likelihood of approvals through manageable, discrete stages. This is a large project. We wanted to make sure that we put it in bite-sized pieces, in a sense, so the Government of Ontario could really envision, get their arms around, and be able to fund it relative to the number of demands that they face in healthcare throughout the province. So let's go right to the South Campus design. The South Campus will also be completed in stages, building on a graduated model. The first part, as I mentioned earlier, is the ambulatory health hub with an urgent care center, and within 10 years. This health hub will have surgical services. For example, today, of course, all cataracts are completed on an outpatient basis, but at RVH, we're also starting to complete our hip surgeries on an outpatient basis. So you can envision this health hub as being a very active. Ambulatory means no inpatient beds in that phase of the model, but a number of services being provided here on an outpatient basis. Then in 15 years, we'd add an inpatient unit, and as I mentioned earlier, it's not a unit that would be dependent on emerge, because that would be unsafe to put in place prior to, which is the last phase, and that is having this acute care hospital, 24/7 emergency department, and operating rooms that can operate around the clock, as well as intensive care. There could be a helicopter pad as well, so that it does become that full functioning facility, and choosing the property to ensure all that happens is, of course, very important. At maturity, the South Campus will house 285 inpatient beds, and this will include space for our partners so we can better coordinate care. An Ontario Health Team concept is the current word being used for that, but that would be a space in total, particularly the health hub piece, that would have other agencies under the umbrella of this physical plant and be able to provide care for patients in a more coordinated fashion. So the model you see here, of course, is just on a generic piece of property, not likely ever to find a full square property for our hospital, because we haven't yet determined the South Campus location yet. Our planning team is working very closely with the town of Innisfil and its planning department through many processes. We know that the South Campus will impact healthcare for generations to come. So it really is a once-in-a-lifetime decision for all of us. That's why our South Campus Site Selection Committee, which includes community representation, has spent over 2 years on a very thorough, fair, and transparent process. The committee started with 225 square kilometer search area. We chose the search area because we felt that a drive time to a hospital would be reasonable to be about 15 minutes. The primary area in that particular rectangle, all of those residents, a drive time to a hospital, whether it be Southlake or Stevenson, or even most of it up to RVH, is greater than the 15 minutes. So we chose that area as the area of our new hospital that wouldn't interfere with the great work our partner hospitals are doing, but really make healthcare more accessible for its residents. So you can see Lake Simcoe, west to Highway 400, Kempenfelt Bay, down to just below Highway 89. And I want to draw your attention to the green dot. That represents the 50 acres of land at Yonge Street and the 6th line that was generously donated to RVH by the Cortel Group back in 2009. And we are extremely grateful for the gift from the Cortel Group. This is obviously a close-up of the property on the 6th line with Yonge Street just to the east. And it is important to note that we're very, very grateful, but as well, we must also note that we are a publicly funded organization. And it's critically important that we put the land through the same thorough assessment, criteria, and analysis as we do every other property we're looking at in the 225 kilometers. I'm sure we all agree that it's vital that we choose the right site. So to help us narrow the search, we used very clear, weighted criteria, both mandatory and desirable, that were approved by our board of directors. Through that, it took us down to 47 sites for consideration. From there, we overlaid that there were 2,000 other data points to include current and future transportation networks, natural heritage systems and agricultural designations, community consultation, and site visits. Through that process, we were able to narrow our search down to 9 top-ranked sites. While we started with 5 zones within that area, we moved to 4 zones because the 9 potential sites just showed up in the 4 zones. And we've added the more recent development and vision that the council approved in the fall of 2019 regarding the orbit. So Zone 1 is the Highway 400 corridor. Zone 2 is South Barrie, North Stroud, Yonge Street corridor. Zone 3 is the South Stroud, Yonge Street corridor. And Zone 4 is the 6th line in Yonge Street. We then went back to our community to ask for feedback on an online survey. So I think what's important when we looked at that, and we also looked at how a hospital is actually compatible or not compatible with the built environment. There were a number of areas that we thought we should bring to everyone's attention that we have to take into account when we're building a hospital. For example, as a hospital, we have a number of hazardous materials. nuclear, radioactive, flammable, and explosive materials. Bio-waste, of course, from body parts, and hazardous waste as well. And all of those have to have dedicated storage requirements on site. With respect to utility services, we know we are high consumption organization of electricity, natural gas. We have shared services with the community, and we may cause disruption to services into surrounding communities. Not that we're ever intending that, but as a 24/7, 365 facility, this can happen. With respect to water and sewage, we are high users of water and sewage. This is a requirement for Government of Ontario that we have clear and easy access to a traditional method. Also, there's impact on municipalities for current and future hospital expansion demands. So whatever we build in 10 years from now, we've got to be taking into account that 20 and 30-year time frame as well. And of course, our demands could negatively impact the water and sewer services in surrounding communities. So all of these elements are really important as we're trying to also use the many reports that are before us to choose the right site for really a 50-year project. In addition to that, of course, there are benefits to where we locate a hospital. We know from research that, in fact, patient recovery can improve when a hospital is located far from dense urban activity and it's integrated with green spaces. And there, it too can have a very positive impact on patient's recovery, also the length of time it will take a patient to recover. There are challenges with respect to a hospital on impact on community environment. For example, this is very timely with respect to the coronavirus, but hospitals have a lot of germs in them. Patients and occupational exposures to nosocomial or hospital-based and acquired infections are just a part of the everyday life that we have at a place like RVH. It's a very noisy area to be beside or near a hospital. There are ambulances and helicopters and delivery vehicles and emergency generator equipment, and this can have an impact on the surrounding residential areas. Residential parking can be affected by staff and visitors occupying neighborhood spaces. And finally, there can be possible tensions, all of which we'll try to avoid between area residents and administration due to the mixed use of the surrounding areas. So we just wanted to really give you a sense of the number of elements we look at when we're trying to ensure that we've placed a hospital for the future in the right location. We also did receive feedback through a survey. Over 1,000 people commented on where they thought the optimum site for the South Campus would be. And over half of those who responded to the survey were from the Innisfil area. It's important to note, I think, that between the Highway 400 corridor and the Yonge Street corridor, that is where the majority, close to 3/4 of the respondents felt that would be the right location for a hospital. Fewer, of course, in Alcona area and even fewer in the donor land on Yonge Street and the 6th line. It was really just a way of engaging all of our residents in what we're doing for the future, and yet they also gave us some key feedback for consideration as we were trying to choose the location of the hospital. They thought it was important to have easy access from major roads, including Highway 400, multiple access points into the organization, and an alternative road access if Highway 400 is ever closed. Ability to service the site quickly and begin construction quickly. I think the residents of Innisfil would, if they could, they'd like to have had a hospital yesterday, and so they know they want us to get moving as soon as possible. The hospital should be close to existing or planned public transportation. We must take into account the impact on the surrounding community and residents, noise and traffic. We have to align with planned development population centers. There is an environmental impact they're concerned about, not too close to Lake Simcoe. Consider the impact on the wetlands. A central location to all populations to be served. That would mean Southbury, Alcona, the Highway 400 area, as well as the developments to the south. Close to amenities, access for emergency services, close to the new Rosardo Health and Wellness Center, the community connection close to Innisfil Fire and the YMCA. Proximity to existing hospitals, about a 20-minute drive time is seen as reasonable to enable transfers between the two sites. Proximity to Sandy Cove and Friday Harbor, must be on the main arterial road other than 400, and additional land for expansion of other services was very important to consider. There were a long list of items. We thought we'd pull out a few tonight to let you know what your residents thought in terms of what was important to them for their hospital of the future. So just briefly on the North Tower, this is our current North Campus at RVH. You can see in the background, that's the building that opened in 1997. More of the foreground represents the 2012 expansion. And it's important to note that 60% of Innisfil residents receive their hospital care at RVH. and many will continue to go to the North Campus for more complex care needs. The North Campus expansion, broken down into a pre-tower and tower phase, will double the size of the health center of the North, again. So the first in the lime green color is what we call the pre-tower phase. This is where I mentioned that about 91 beds could be added. We'll see significant renovations and expansions through the health center, such as critical care, which is at full capacity most days, and maternal and child cancer clinic, mental health, and outpatient clinics will be developed. We'll also expand, as you can see, the building just to the bottom left-hand side of the screen is called Rotary Place. It's an administrative building, a lower cost to build, and we plan to double it so we can free up the clinical space that's necessary in the current building so that more clinical spaces can be developed there and non-clinical spaces can come out to Rotary Place. We'll then move into the tower phase, and this is construction of a 9-story tower, approximately 800,000 square feet of new space, including additional beds, but really focusing, it's hard to tell in the picture, but there's a deeper or floor there, and that's really expanding our surgical services at RVH. There also need to be, clearly we're taking up a lot more of the very precious land, and we'll have to have a parking strategy in place. So if the pre-tower and the tower phase could happen along with the South Campus Health Hub, we will have, and the rest of the South Campus, will have a total of 943 inpatient beds between the two campuses. So you might ask, why is RVH considering a South Campus location other than the donated land? And I want to say again, what's most important is that we choose the right location for the South Campus, and we are responsible as public servants to consider all options. So through our process, the donor land is always part of the discussion. But it's important to note that the cost of the land, which is the smallest blue dot at the bottom of the screen, is so small compared to the cost of construction, which is actually quite small compared to building a building and designing a building that keeps our maintenance costs in alignment. And of course, overall, what we really have our eye on will be the operational costs, the efficiencies that are required, because this is really in the 50-year hospital life cycle, the true cost of the project is really many years away. So even the cost of construction is small, as I've mentioned, and because we know even today at RVH with our building, it's $1 million a day to operate it. So we want to be keeping in mind always the longer range goal, the long plan, which is to ensure that we are keeping the operational costs in mind as we're moving toward this project. So we talked a lot about healthcare impact of the South Campus build and the North Campus expansion, but RVH's development will also have a huge economic driver as well. The number of staff and physicians has increased significantly since we opened our expansion, and we know most of them live in Simcoe County, here in Innisfil, as well as in Barrie. So this means they do a lot of their spending in our local economy, on houses, local groceries, restaurants, and other businesses. Hospitals also drive business around them, and the Georgian Drive used to be considered out in the country. I'm sure many of you were in the area when someone said, why are they putting a hospital up in the middle of nowhere at North Barrie? And look today of the amount of the economy that is developed around the hospital. So using a commonly used wage multiplier calculation, RVH's 18-19 payroll translates into an annual spin-off impact of $161 million to the local economy. So at maturity, with the South Campus built and the North Campus expanded, RVH will employ over 3,300 full-time staff. The economic spin-off from payroll alone, which doesn't include physicians' billings, will increase to $259 million in 2037, 2038. Simply put, having a hospital in your community is very good for business. And that economic impact doesn't factor in the construction period itself. We're just giving you an example that RVH's 2012 expansion required 1.7 million person-hours of construction work, and 80% of the tradespeople who were hired for the project and the suppliers were local to the region. And we know it's too early to estimate. We do know the economic impact of the expansion both at South Campus and the North will be very, very significant. The economic benefit in the short and long term is significant. So we're excited to say that the pre-capital submission, which is really just getting us at the starting gates of a long marathon to get these projects approved, has now in the government's hands as of January 29th, 2020, following a board meeting where the board of directors approved the pre-cap submission. With that, we are now ready to move into stages 1 through to 5. So we've spent 2 years in a sense, working through a project with high consultation, excellent consultants, lots of feedback, and now we're ready to start the race of getting the projects approved. But we did seek Ministry of Health throughout our planning process, and so we believe that once the pre-cap is actually approved, we'll be able to move through some of these stages relatively quickly. We are confident that our plan is very aligned with the government's priority to end hallway medicine while integrating and streamlining care through the Ontario Health Team model. At a later date, we will submit a separate and distinct submission to government for the full-service South Campus model. Right now, we've submitted for the South Campus Health Hub and the North Tower and the Pre-Tower. And although the Pre-Tower South Campus Health Hub and North Tower pre-cap submission is separate from the future South Campus full hospital submission, I just can't stress enough that they're completely dependent on each other. We designed a two-campus, single corporation model. Barrie residents will come to the South Campus Health Hub for outpatient procedures, and Innisfil residents will still come up to the North Tower for more complex trauma incidents and surgical procedures requiring intensive care unit for the first 10 years of that model. If one doesn't proceed, the other one isn't large enough. If the other doesn't proceed, the other one isn't functional enough. So these are absolutely tied at the hip. It would be impossible to separate. They were not planned or designed to proceed independently. So the South Campus build and the North Campus redevelopment must both happen in order to meet the hospital needs of this region now and in the future. Community consultation has been foundational to our two-campus integrated model, and community feedback has informed every part of our planning process, including the South Campus location, the design of both the North and the South Campus, and the services offered at both sites. Our commitment from the very beginning was that our community consultation would not just be a check mark. It would be broad, inclusive, and most of all, genuine. I'm glad to see both Jessica and Carling here as two of the members of our corporation communications team who led many of these initiatives. We have logged over 27,500 engagement interactions over the past 2 years. I think really Suzanne Legui and her team have written the book on how to have a community consultation for a future hospital, because it is actually unprecedented in an Ontario hospital. We've consulted Team RVH, including our volunteers, partners in other education centers, patients, visitors, donors, the general public, diverse communities, including those most vulnerable in our society, and elected representatives. Our engagement approach was not a one-size-fits-all. We developed a strategy that provided many ways to hear from stakeholders, including community presentations and focus groups, a partner summit and expos, surveys, and social media polls. The innovative street team from RVH was out in our communities talking to parks, talking with people in parks and at beaches and festivals, and they also attended the Innisfil farmers markets. We engaged our volunteers equipped with iPads and our bedside entertainment system to survey patients and families in our health center. Those interactions have been informed every step of the planning process, and the thousands of stakeholders we spoke to, they will see themselves in our plan. Tonight, we've provided you with a copy of our community report. The 16-page report talks about our consultation process, who we talked to, the comments and the feedback themes that we heard. This report was also submitted to government along with our pre-capital submission. In closing, RVH is excited about this project. We're excited about what it means for healthcare for our area residents, for the town of Innisfil. We're excited about the economic role RVH will continue to play in South Simcoe as one of its biggest employers. And we will continue to engage you, the residents, as well as we move through this planning process. I encourage you to learn more about our project and provide feedback by going to our dedicated website, rvhplanourfuture.ca. And now, with your permission, Mayor Dolan, I'd like to invite Barbara back to the podium in case there are any questions you'd like us to answer. And there's where we started, I guess, a little while ago, Mayor Dolan, with the groundbreaking, and that was our very first patient at the Rosardo Health and Wellness Center back in December.
And that was a very cold day as well, if I recall.
Very cold day.
And I will tell you that as of March the 2nd, if you could tell all of your staff and patients at the Rosardo Health and Wellness Center, they will have a place that they can have their lunch. A healthy restaurant is going to have their soft opening at the Hordinsky Community Kitchen.
Fantastic.
So, questions or comments? Deputy Mayor Davidson.
Thank you for the presentation. It was actually I really appreciate it. It was nice to be brought up to speed. My only concern is with getting enough doctors and healthcare providers for this as we grow the South Community Hospital. Do you see an improvement in getting doctors and physicians and healthcare providers available for it?
What I've been told is that although we had trouble keeping physicians or getting physicians into Innisfil prior to the opening of the Risardo, we weren't quite inundated, but there was quite an influx of individuals asking for opportunities to be part of the Risardo. I think, yes, I think there will be a strong interest in it. There are currently health practitioners from Innisfil who are commuting to Toronto, who would like the opportunity to stay in their own community and practice in their own community. So I think we haven't really tapped that group at all. But I also think this is to be part of a brand new institution. It's pretty exciting, Dan.
Okay, so to follow up. So I know that Mayor Dolan's been quite involved with physician recruitment over the years, that she's been working at it. And your opinion as well, that's my only concern, is getting enough people to build. It's no point building it if we don't have the doctors, we don't have the healthcare providers, that's all.
Would you like me to comment? We have this philosophy, build it and they will come. And we have, if you might remember, Dr. Bryn Presnell was the only cancer doctor in the Barrie and Simcoe area for so many years. And once we built the cancer center, we now have 18 oncologists on staff, and we have more applicants than we can deal with. My little other example quickly is in cardiology. So we had Dr. Brad Dibble for years as the single cardiologist in the area. Then we built the cardiac units. We developed a whole program, and now we have 8 cardiologists serving Simcoe County region. We're about to go to a 24/7 model, which means our STEMI code patients, heart patients in heart attack will be able to bypass hospitals and come to our merge straight up to that unit and provide the life-saving care that we've been working on for over a decade. So I think the build it, they come philosophy, we've really been able to demonstrate that. There's going to be a health human resources shortage everywhere. And if we build an exciting model together for South Simcoe, it will be very attractive for our graduates to come to. It's a great place to live.
Councillor Sadi.
Thank you very much for the presentation and the update. When I was looking at the data that you provided on residents giving their preferences for locations, and I was just surprised with the low percentage for 6-line Elkona and higher for Yonge Street and the 400 corridor. Were there more input data from Barrie residents as opposed to Innisfil that I'm wondering if skewed this? And following that, how much does this input data play a part in you determining the location of that campus?
Thank you for the question. We had a little over 1,000 responses to the surveys. We were really excited about that. Close to half were Innisfil residents, but there were residents from Bradford, as well as Barrie residents and Springwater residents. So I think it was more dominated by the town of Innisfil residents, and I think the town had a strategy to ensure that residents did get out there and have their voices heard through the survey. It is not a criteria that we're using in terms of coming from the 47 sites to the 9 sites to our preferred site, but it was more of a weather barometer reading of what residents were thinking about when they could envision a South Campus and where it might belong. As it turns out, of course, the 4 zones that we're still looking at properties in also align with everyone's thoughts around where a hospital belongs. So I think that was very reassuring. The residents said from the beginning, access from Highway 400 and expanded Yonge Street are very important to them. So I wasn't really surprised to see the 400 corridor as being identified, and Bradford residents getting up there, or even anyone getting to that. And we don't have municipal boundaries in terms of the services we provide. We can provide services to anyone in the province of Ontario, but we better make sure that access to those services is relatively easy, particularly in a crisis situation. So I think it didn't surprise us, the information we received, but it wasn't a criteria weighting in terms of what the board will finally decide will be the final property.
Any other questions? I was